Generally, bariatric surgery is very, very safe. It's safer than having your hip replaced or having your gallbladder removed. But there are some risks that I want to make sure you know about. There are the risks immediately around the time of surgery, we call those perioperative risks, and then there's short-term risks several months out, and then there are long-term risks. The perioperative risks are the risks that anyone has to undertake when having surgery. Risks of bleeding, risk of anesthesia, risk of reaction to medications. Those are really unusual, and we do extensive pre-op testing to make sure that we catch anything before we go in. We check your heart, lungs, and so those are pretty unusual to have that. Intraoperative risk, the rare risk a physician, myself, could damage something inside. That's very unlikely, but it can occur, and we talk about those in the office, and we have a disclosure sheet you can read. We give it to you at your first visit. But generally, those risks are very, very low. And then the risks after surgery. Generally, the two big risks we worry about are a leak from one of the staple lines, whether you have the bypass or the sleeve. When we staple across tissue, it can leak. Generally, with the bypass, you're pretty safe if you get by 2 weeks without a leak. You're not going to leak. It'd be very unusual. With the sleeve, most leaks are early, but you can have some late leaks out to 3 months, which is somewhat unusual. We have a very low leak rate. The risk of that is less than 1%. Generally, these can be managed non-operatively sometimes, not all the time. The mortality rate in bariatric surgery is very low, 1 out of 1,000. Another serious risk is pulmonary embolism, which is when a clot forms in one of the veins, either in the legs or the pelvis, and then it can travel to your lungs and cause cardiorespiratory problems. So we take great pains and measures to prevent those risks. Before the surgery, we'll give you a shot of a blood thinner, and then after the surgery, we give you a shot of a blood thinner while you're in the hospital. And most of the time, we send you home on a blood thinner for either 2 or 4 weeks, depending on your risk. So we take great measures and proactive to try and prevent these issues. We perform endoscopy at the end of our cases to do a leak test, which many centers might not do. So we really care about our patients. We treat them like family. Long-term risks, sleeve, pretty much nil. First year, maybe your gallbladder can go bad with a bypass or sleeve, 10 to 15%. Heartburn is a potential long-term risk. If we give you heartburn, if it's mild, over many, many years, it can potentially cause issues in the esophagus, something called Barrett's esophagus. So that is a concern with the sleeve that is a potential long-term unknown. But it's been out about 15, 17 years now, and we aren't seeing major issues with that yet, but that is a potential concern. The bypass has been around for years. We know what can happen. And in the another video on the bypass, we talked about ulcers, bowel obstructions, and access to the remnant, and those are the main things that can happen long term.